Yajong. On today's episode, join me as I chat with our friendly Hmong speech pathologist, Lou Vang, about what brought her to the field, what's keeping her here, and where she wants to go. Hello, for today's episode, I am so excited and happy that my friend agreed to do this recording with me. She is um, a Hmong speech pathologist. I've heard of a few other ones throughout, the last few years being in the field as a BCBA. I've wondered, I wonder if there are any Hmong speech pathologists out there because I work hand in hand with them. So when I started the podcast, I knew I had to do an episode with her and just kind of really pick her brain and just have more conversation. So Lou, welcome to the Let's Talk About Autism in Hmonglish podcast.
Yeah, thank you so much for having me on and for valuing what I have to say and bringing me on. Thanks so much.
Of course, whenever people hear, oh my gosh, I totally forgot. Let me start over. So we just chatted about this. Okay, so yes, the podcast, right? It's because we're talking about speech, but then a very key part about the podcast is that we're going to talk about autism in Hmonglish. We're like so Hmong American. We're like, so comfortable just to have our usual conversations. But yes, okay, so whenever you mới tụi mình nhỏ nếu mà autism and cái cho mù thầm mỏ lấy the okay nếu mà nếu mà autism là lấy yo hay tia còn như mù probably the first a treatment or therapy that they recommend is speech, right? Especially if they're young.
Mhm.
And so our home parents, whether Leah, y'all in your Laminji or y'all even yellow, right? They're like, speech, what does that even mean? And also that's probably the first thing that they notice too. Yeah, you me you yung pa hai ni chi hai lu te jo thon de di ha tho you chim ji and you tini mu uh talk to your doctor anyway. So now they're going, okay, yes, we're going to give you a referral for speech. And then you're like, what does that even look like? What does that mean? Look through your kanu halu na, ki ku tu yan ni ti ku kanu halu chi tao e lo your kanu halu li ja, right? And so that kind of goes to my first question, Lou. What does an SLP, which stands for Speech Language Pathologist, oh my gosh, please don't judge, Speech Language Pathologist do?
Well, don't worry if you can't pronounce it, then I'm here for you.
I know you are.
Because I'm an SOP. So, yeah. So, usually, speech is kind of like the first um, thing that children get referred to whenever there's like a suspicion of like autism or whenever there's been like a diagnosis of autism because language like a speech delay usually really is like that first thing that you notice whenever you notice that like something's like not quite right. So usually like we'll get like that referral sometimes before like the OT referral comes or before like the ABA referral comes. Yeah, so the reason why we get that referral coming to speech therapy is because speech is so like foundational for like all of these other skills, right? Like
Yes.
I mean, like if you can't follow like verbal commands, like how can you participate in like OT or how can you participate in like ABA? Yeah, so what in speech therapy, what we do, I'm gonna try my best to like interject some Hmong in here before
Yes.
I just start
Yes.
rambling off, because I definitely want, các your listener or hai lượng Hmong tiếng cái sĩ lượng Hmong đâu có lữ lữ nó thế lữ họ
Yes.
đâu biết your information that nó thế so
Yes.
yeah, let me try my best. Yeah, so in speech therapy, because speech therapist ma be chỉ要用一里念的词，我这里有还亚的去了这里还都没有没有那亚的去了可亚我就可到的时候亚我就可知道了这里干了，所以那 big speech therapist 给
Mhm.
可被我跟到给了应开还的mình nhỏ lo lo mà thôi dạ wo lời yo bố cái yo tế dạ lù trong lý nó cái tất cả wo hiểu tôi tế dạ lù trong lý tới cái tất cả cái yo cái tôi dạ nó tế dạ nó gì cái bây giờ speech therapist bây bố hay tiệt mình nhỏ cái hiểu tôi đã chỉ vấn đề cái mà hiểu tôi đã chỉ tất cả but it's like for the untrained person it's like if you're just gonna teach them like all these like different concepts and all kind of like a randomized order like they may not be able to pick that up as well but speech therapists, we can identify kind of like what their skill level is. Hay dia tụi mình nhận được là họ lý giải theo lời từ cỡ tôi giải đã chi theo lời cho cái cỡ cho họ từ cái bé cho speech therapist bé mà lý bé con đời a mà lý khiêm gì, right?
Yes.
Yeah, so that's kind of what speech therapists are trained to do to be able to identify like the current skill set that they have, and then identify like okay, so like what is like the next like developmental milestone that they can achieve based on their current skill set.
Yes, and I said earlier that I work as a BCA, work hand in hand with speech SLPs, and but that is not to confuse anyone. That our concentration is very similar. Although we'll talk more about
Mhm.
that later about how you use a little bit ABA and what you do. Because I do just very little, maybe vocal imitation, echoics, right? But you, in your therapy, you guys dive even deeper than that. And so I recently had, for ABA. And then during the assessment with the NICHO, primary reason, ABA, oh, we want him, it's for speech. And I said, well, this is the wrong treatment. I mean, for speech specifically, we do very little speech. If you're here for speech, you need to go to a speech pathologist, right?
Uh-huh.
We do basic imitation, basic echoics, then of course, manding, right? All that stuff. But then really it's so important to get treated by a speech pathologist. So, I mean, all the speech paths I've ever met have been amazing, and remains to be true. And I'm so proud to know you and to know and brag on you and be like, this is my friend Lou. She's a Hmong speech pathologist. Hmong. And I'm just curious to know, Lou, what brought you to the field?
Yeah, so it was I mean like I'm just so like I think I'm a pretty easygoing person, and
You are.
like if
I
you ask
agree.
me anything about things, I'm just like anytime anyone asks me like like so what do you think? What do you want to do? I'm just like, "Oh, like I don't know. Like what do you think?" And so that was literally like the attitude that I had going into college. Like
Yeah.
it was like, "Mom, Dad, like what do you guys think that I should do?" Like I literally have no idea, because like anything that I do, like I put my heart into. So like I've never really like done anything like made a decision and then like went awry with it.
Hmm.
I'm very fortunate to say, because I kind of always just try to like do my best in whatever I get into. So I kind of had the attitude going into college, and like that's not good, because like you really need to like know what it is that you want to do, what you're passionate about. And
Well,
somebody
that's
was
what
like,
college is
"Oh."
for, though, to discover all that. So you did great.
Well, thankfully, some I had this relative, and she was like, "Oh, like you should be like a speech pathologist." Like go and I was like,
Hmm.
I don't know what that is, but okay." So I was just like, okay. So I declared it out as my major, and then luck would have it that same summer I met this like distant aunt, and I noticed that she talked a little bit funny. and she was a little bit slow to kind of like communicate. And so
Mhm.
after I met her, I asked some of our other family members, like, what kind of condition does she have? Because I noticed that her communication is just a little bit different. And then that's when they told me that,
Mhm.
oh, she's had a stroke, but she
Oh.
actually went to speech therapy. She went to speech therapy for a good while, and
Mhm.
that's why her speech is as good as what it is now. And I was like,
Okay.
wow, like, you know, people do that? Like, that sounds so cool. Like, if
Yeah.
I could do something with my life, like, that's what I would do. And then that's when it
Oh.
clicked for me, like, wait, like, that's what I am going to school for. And that's when, it kind of came together, like, yes, like, this is what I want to do. This is what I'm meant to do. Um, and now it's been like I was just talking to Tio before this started, that, this past May was like the 10-year anniversary of like when I graduated with my
Wow.
master's degree. And I'm not sick of it yet. I was just driving home today and thinking about like how lucky I am to be in this profession.
Yes, definitely. I would like to say that even though I totally agree with you, but even though there are moments when you're like, "Oh, today was so frustrating," or, "Oh," like all these other things around your job, right? It's like it didn't go your way, but at the core of it, the science of it, like, like we kind of nerd out a little bit, right? We're like, "Yes, I love ABA because of the science." If we can just look at the pure science, it's so amazing. I wonder if that's the same for you.
Yeah, oh yeah,
Yes.
absolutely, yeah. And sometimes I'm like, I should go get like my PhD so that I can
Mhm.
explore like all these like interesting like topics and stuff. And I'm like I really like being a clinician and having that like client interaction. That's really what my heart is after.
Oh my gosh, 100%. I've thought about that, and then I was like, "I don't know, I kinda don't wanna do research." I feel like where I shine is as a clinician, you know what I mean? So, but
Yeah.
you never know, one day when your son's older and you have all this free time, Lou, if you go for it, I will be, like, definitely cheering you on, so never say never. So you said, that's a great example about the ant, right? So other than individuals with autism, and you said she had suffered a stroke, right? So like, why else would an individual seek speech therapy other than like what we had said about individuals with autism or individuals who had a stroke? What are some other reasons why an individual would get speech?
Yeah, we just see so many different things as speech therapists. In adults, we can treat um, speech and language and cognitive disorders and swallowing disorders because
Yes.
we are kind of recognized as in the medical field as like the like oral motor and like pharyngeal anatomy and physiology experts.
Oh,
So
yo, hold on. Lou, we forgot. Our our listeners are like, "What is she saying?" That's a lot of big science words. So, do you mind to go back and say that in
Yeah.
Hmong about the oral motor and all that? Because I think that's really important, right?
Yeah, yeah. Thanks for reminding me, Tia, because
I'm
I
like
can
the
I can kinda
Hmong
tend to
speaking
just, like
Hmong police today.
yeah, I can kinda just, tend to ramble, so thanks for reeling me back in. But yeah, for your, Hmong listeners,
Yes.
我弄ư thà tà shi nó của, nga shi lùng Hmong kì, cú tá tỏ hai đô thìa hai tìa, bây giờ speech therapist mà bây giờ, bây giờ cho nên 我 nga shi theo bố cho, lúc còn yêu đúng lại,
Mhm.
they dạ ở nhớ hậu dụ dụ cha đã thế they they mà số they cái they lên ở nhớ hậu dụ khẩn yêu thế dụ dụ cha đã kỹ bị họ yêu cho medical professional or yêu hay you monstro e yo dia you tên lên tên họ có chỉ tao mò nó chỉ bé họ
Mhm.
sư kia có you tên lên tên tên mà số tên lên để tất cả chân họ mò là chỉ tất cả sư hay lu um yeah so and same thing for you know, like a lot of these like degenerative conditions they are more or you there you more a you gilly your mom a your chi so trong ta lo ye big speech therapist or be ho bo clear hai de no to ya more da chi da ho hai lu li ya a tilly your ga you got để mũi ở đây you more ya more that you yin kia li yo chi trong ta lo na yeah, so we can see adults for you know, all of those different kinds of conditions like strokes, degenerative conditions like ALS or like Parkinson's. But yeah, I know that đâu giờ 我弄还了解对手要多弄他做 autism 了是他做民有药 so yeah, we do a lot of work with children too other than autism
Mhm.
yeah, hay tia với thứ mình nhỏ lan chế nữ chỉ nó lu
Oh,
cái giờ tên nữ
yes.
chỉ nó lu cái nữ yo cậu chỉ tàu lu cái nữ yo bông cá hay lu thế gì cho mình nhỏ và lan chế là nó chỉ trong cái bé họ ba cho mình nhỏ tới thế so yeah like hearing loss, autism, là một cái số mình nhỏ lấy những nhỏ cái li bông cá hay lười những họ chỉ mua giờ đã chịu khét đâu hay tiếc giờ vì lý trả lời bông cá hay lười lấy những chỉ mua autism những chỉ mua đã chỉ or you know it's wrong with like the child but for like some unexplained reason they're just like speech or language delayed because speech
Mhm.
therapists making you know 我后来睇見有人都講了 so that they can catch up with their peers as well. So yeah, there are just so many different like conditions that we see as speech therapists.
Yes, and you know, as you were saying that, it reminded me that just a few years ago, I had my first client who he has autism, and he also has a dual diagnosis of selective mutism, and I was like, "What?"
Oh,
You know what I mean? So,
yeah.
have
Uh-huh.
you treated individuals with like a dual autism selective mutism diagnosis?
I actually have I was just thinking about one of those patients of mine this morning and then I was just
Mm-hmm.
thinking about another one who I had but it's been at least like 3 or 4 years since I've seen him. But yeah,
Mm-hmm.
I was just thinking to myself this morning about how about her and how I need to go get more resources. Yeah. But
Yes.
yeah, like that's not something that I see often, but that's
Right.
just kind of like the range like, that just gives you an idea of, like, the range of, like, different things that I see as a
Right.
speech therapist, anything from, you know, autism, which is probably, like, 80 to 90% of my caseload, to
Okay.
this kinda, like, weird outlying condition
Yes.
like, selective mutism, yeah.
Yeah, so Lalu, selective mutism. From my understanding, Lou, okay, correct me if I'm wrong or add more. Yo, chấm như yo, so nu zhongli nu chi sometimes the joke zhongli nu chi no you nu chi te you ta shi nu o nu shi nu cha nu bo ta shi ta to cha nu ho hai te la lu you te o cha nu ho ba lo no. O cha nu ho hai okay, o cha nu ho ko I lo lu no thia. Ta shi maybe 99% of the time you use Chicago. Is that correct?
So, selective mutism, I think the majority of people recognize as like a psychological condition, psychological
Okay.
cái do 我nhóm的呀呀后女路路呀我女女啥嘅以前呢我摸 selective mutism 嘅雷英即係雷英波係雷得是主要係啲雷似lời sai sai hay tiệt tu từ lời yo cho nên thả đó是lời tu yo tiệt lời chỉ sai tiệt lời yo cho you thả cái lời yên chỉ lời chỉ cảm đó you thả yeah so a psychologist or ít thứ cứ chua or cứ cho lưu lưu thế cho cái啥cái từ cứ chọn được cái thế lý do từ or your cho ba team li do speech therapist so she do nai ku ba to do min yon so that's yeah so that's what selective mutism is
Thank you for that, Lou. I had
yeah
a very, very like basic understanding of it. But I think paired with the autism diagnosis, it was just like it kind of changed how it looked like too, right? The characteristics
yeah
of what
oh
we were seeing,
absolutely
you know.
uh-huh
So um you on your head, you saka, you jamio, hello to you, or chia hello sana, just communicate. You learn ni na chi le bao kaya you tili ba le tili ga shia le tili, lo lo here le tili chi ti de call you le sana kono so le tu hai chi ta hai te ko sana kono, that's frustrating, right? And so that is a diagnosis under the umbrella that I've always been really curious about. So you said 80% of your caseload are individuals with autism. Is it mostly kiddos or do you have adults too?
I treat kids sometimes from as young as like a few weeks old all the way up into their like 20s. Yeah, so nhóm từ tụi mình nhóm từ lo sĩ tuần hình từ nữ sa cỡ tàu giả đã chín gì thế nữ bố một bệnh sự cỡ môn gì xí mà yeah so
Okay, wow, a few
I
weeks old.
yeah, yeah.
Yeah, what kind of
The
things?
and I guess that's more so for my ones maybe who had uh like complications during like birth or pregnancy who
Mm-hmm.
maybe have like difficulty with like like oral motor stuff.
Okay.
I may see them that young.
Um,
And I'm sorry, are we still talking about autism or kind of just in
Oh, I'm
general?
just totally curious about like how
Uh-huh.
a speech path would treat a 2 week ago because my baby, he's a year old now. When he was born, he was tongue tied, and that was the first time I ever like was like, oh, he's tongue tied. How do we treat that? And they did a frenectomy, right? And
Oh,
so yeah,
uh-huh.
so like he was like 2 days old, and they did the frenectomy. So because we were hopefully did. We were proactive and we're like, we don't want him to right underneath the blindness. So we went ahead and did it. And I'm curious if we had it, would he need, speech like therapy? Is that something that you work with too? Kiddos who are tongue tied?
Yeah, yeah. Yeah, so whenever we assess and if there is a delay in kind of just like oral motor skills, like even just whenever babies are born, they're supposed to have like certain kind of like reflexes and stuff. And believe it or not, sometimes those reflexes are like absent. Or there's like a muscular weakness, and so we kind of have like our own little tools on how to
Hmm.
help those skills come along, those skills that we take for granted and think are just kind of like reflexive or that we're born with.
Yeah.
So yeah, speech therapists can help um babies who are just like fresh out of the womb. Yeah.
Yeah. That's amazing. I didn't know that. You guys are the true early interventionists. You guys go in there 2 weeks. We're like, hopefully you guys come to us at 3. So, Lou, for y'all, let's say they have autism, right? They, like I said, they're almost 3, close to 3. Usually that's when the pediatrician's like, okay, let me give you a speak referral. They come to you, you do your evaluations. What are some basic goals for an early learner? So, 똑같으면요, 아비형 내가 사이에, 아비형 너도 좀 빨아지, 그게 뭐 speech 원하지는, 그렇게는 하는 지따위 the speech, therapist, no, you can read So, what are some goals that you put together?
Yeah, so everybody who comes through my door is going to be a little bit different. So I'm going to treat everybody
Sure.
a little bit differently based on how they present, what skills they have and what skills they haven't yet acquired. But usually the goal, the very very first goals that I try to address Tao thao ya wo gu sa khe de min yo ga nu zu wo ge zhu yo make any form of communication. I usually write what's
Mhm.
called a total communication goal, which is any method of communicating, whether it's through like gestures, just like 别的了是都得我说 like all of those things I we should accept as communication, or like making eye contact, vocalizations, that's usually like the very very first thing that I want to address. Because some kids, who come into my office, it may sound very silly to people who aren't exposed to like a lot of children who are like this, or who have like typically developing children. Like, why are you gonna like address something like that? Doesn't that kind of just like come naturally? And you would be
Mhm.
surprised that in certain conditions, and especially like autism, like those skills aren't present. Like some
Right.
kids don't have any desire to communicate. They kind of are just very low sensory wise, and don't try to make any sort of like communication, or they the only thing that they'll do is just cry, or maybe they don't even express their needs at all. Like maybe they don't even cry, because you hear a lot of moms of babies who or of children who have autism. Like those moms will look back when their kid was a baby, right, and they'll say like, my baby was such a good baby, like he never even cried,
Yes.
he was so quiet. So you'd be
Yes.
surprised that, the skill that we take for granted, that, oh, children will like communicate whenever they have a need, or whenever they have a want. Like you'd be surprised, like some kids don't have that skill. So that's usually like the very very first goal that I address is building that desire to have that like communicative intent, and having that like two-way communication with their communication partner. So that's usually like the very very first thing I address. And then once we do well with that goal, then of course we're going to want to work on things like building vocabulary and things like that. But all of that definitely comes after establishing that we can communicate in any kind of way, in any kind of form.
Yes, and I'm like, we should go to this other question, but then I'm gonna go ahead and stay in order. So my focus is, I mean, you said that you see kids as young as 2 weeks, but then I like I said, jag må autism geitijo, opihyon, right? And same for me, right? Our early intervention is like at 18 months, because up until 18 months, it's kind of iffy. It's kind of gray area. Doctors aren't sure. Parents are nervous. Parents aren't sure
Mhm.
either. And so, another thing that I love about Lou is that when we talk, we always are on the same page about early intervention. That means to be for joy. Yeah, Pitsy, Camino, Jongling, they're just so good, right? They're just really quiet, very peaceful. Life is just really peaceful, and we didn't realize anything was wrong, or the ones who are like, oh, they said that all the older siblings were slow learners too, or Hailu Gakang, Hailu, so they must be okay, right? Um, so you don't get early intervention. You thought in day, you thought you money, uh, like money go on like that. Okay, so we did some assessments, and we need more services. But Johnny okay, they're checking along with that CDC milestone, and okay, they're not meeting those. We're not checking all those check boxes. What's next? And we talked about this the other day at the training that I did locally in early intervention. I think that's such a absurd idea for Beka because they're like, huh? Gusto niyo, okay, say niyo mo therapy. Niyo to or therapy. Even Beka blood 30, 40 hours. And remind me again, Lou, like, what is your typical recommendations for speech for that age range anyway?
Yeah, so for really young kids, like 2 or 3 years old, whenever they're
Mm-hmm.
coming in through my door for speech therapy for the first time for concerns for like autism, we do what research has shown kind of gets them kind of like in that like mode, and kind of get them into like that routine, and kind of like butt into therapy
Mm-hmm.
the most, which is about like 2 or 3 times a week for a
30
30 minutes
minutes.
hour session. Yeah.
Okay, so 2 to 3 times a week, 30 minutes for speech in combination with ABA, right? I mean,
Mhm.
depending on severity and everything. And then there's OT. And as you and I know, we've had these conversations about early intervention. Please, anything high then really call message is a high is yo you do mean your bong ka min you bought the new in your child to mean your new call same age. It's better to be proactive and say, you know what, let's get some help than to thought even ý hướng ở hướng bé hướng gì đó khó thành cái này từ lâu chỉ hướng到hướngเลยthành tới it's harder to bridge that gap, right? Thành tới cái này
Oh,
từ lâu lâu rồi này từ tao ở bé hướng to kind of like develop those habits, right? Or
mhm,
kind of be more set in their ways, and it's harder, not it's not impossible, but there's a really long learning history that we have to go back and undo.
mhm.
So, I mean, I guess this is kind of a rhetorical question, Lou, but do you feel like early intervention can make a difference in long term progress from your perspective as a speech pathologist?
Oh, yeah,
Ooh, I
yeah,
said it correctly. Look at
absolutely.
that.
Yes, my presence is working already.
Yes, I know. Look at me.
But yeah, there is so much research surrounding, how when kids are younger than 5 years old, like, those 5 years old are the most critical years to, like, learning because that's when, like, the brain is, like, super, super plastic and the brain is absorbing, like, everything.
Yes.
I mean, my coworkers and I were just talking today about, like, I have a young son, he's 5 years old, and she was talking
Mm-hmm.
to me about her niece who was, like, 3 years old, and we were talking about, like, times when we've accidentally, like, said a bad word in front of them, like,
Mm-hmm.
how
Mm-hmm.
quickly like, they picked that up and how quick they were to, like, repeat it back to us,
In
and we
the
were
right
like, "Oh my
context,
gosh."
right?
Yeah, yeah, like, it's just, it's insane how easily, like, little kids pick things up,
Mm-hmm.
and the thing is, like, they don't even have to know what it means, like, it doesn't even have to have, like, any meaning to them, like, they hear it and
Mm-hmm.
they just, like, pick it up.
Yeah.
Whereas, like, for us, like, older people, like, we're a little bit more, like, discriminative as to, like, what we're gonna, like, learn and what we pick up and what we're gonna, like, retain, right?
Mm-hmm.
And that's where that saying comes from, like, "You can't teach an old dog new tricks," which, some people could argue and I could
That is
argue
not
too.
true. You
Um
can.
Yeah,
Literally
absolutely, yeah.
what we do every day.
Oh, yeah, absolutely, but it just, like just like Tia said earlier, it
Yeah.
gets harder, right? Like,
Yes.
the older we get, the more discriminative we are, towards, like, what we learn and what we can absorb and what we
Mhm.
can pick up, so whenever kids are really, really young, like 5 years or younger, that is, like, the best time to teach and, to, catch them up if they have any sort of, delays. That's when, a lot of progress can be made, isn't during those first few years, and the sooner you can get them into early intervention and you can get them help, then, lời thiết lý yo chỉ hay ya phong cá, yo de yo hay ya toi, yo phe hay de to 細細我俾用細細尿布，
Mhm.
即係裏面似落細細尿布，
Mhm.
補面似多個尿布打咗埋你將你冇個腳嘢哋要都咗同到嘅你都崩干到嘅yeah so as soon as like when in doubt go ahead and take them to the pediatrician and start getting the ball rolling.
Yeah, so I had mentioned a little bit about assessments, right? And we're not gonna dive so much into it, but I always like to go back to this, analogy, and really it's not even an analogy, it's, actually what we're seeing. So when you guys do the Vineland or you use it to kind of help you treatment plan?
Ooh, we do what?
The
You broke
Vineland?
out.
Do you use the Vineland for treatment planning, or do you, like, refer to it?
Huh? No.
No, okay, and that's okay. That's like that's like a, I won't say free for all, but almost every clinic I've been to, we always use a Vineland, right? Just to kind of get an idea of base level skills. And a great component of the Vineland is what we call the age equivalence. And so, we know like not developmentally. So we know that they are like a 5 year old. So when they come in, if they're five, and
Mhm.
we do the assessment, of course, it's just parent report. We might be able to gauge where they're at. And sometimes for me, as a clinician, it is devastating when I see a 5-year-old come in and they're scoring at like a 1-year-old, like
Mhm. Yeah.
developmentally. And I'm like, oh my goodness, like you can see why the deficits are there, because like you look gay, so you look gay, ito chi hyong that she look gay, ito I hyong si, or maybe ah hyong. Think about that 3-year gap, and
Mhm.
so you could thought chi hyong le, cái mấy cái little services, early intervention, or actually early intervention is over now. We're just into, therapy. You can, that opportunity to close that gap, just it just uh, multiplied, right? and
Mhm.
and and we don't know that, but we have seen, right, just by our experiences, that okay, so let's say same child, they come to therapy when they're 2, and then we have really intensive therapy. Maybe by the time they're 5, we can get them caught up to maybe a 3-year-old, right? Maybe
Mhm.
even
Yeah.
a 4-year-old, developmentally. That's bridging that gap more than the 1 or 2-year-old. So, I mean, it does make a difference, right? That early intervention piece. And something that I go high the other night is "Jitson chai," "Jitson chai dia." Oh, but you mean, yeah, right? It costs a lot of money. It does. We know, right? But
Mhm.
there's resources out there, whether it's Medicaid or fundings or grant or something for the things that you need. So don't let
Mhm.
that be the thing that prevents you from seeking services. If it's financial, then if it's try diagnosis, like that diagnosis is what's going to get you services, and services, how long they will be receiving services really depends on when they start. What if you start
Mhm.
them in services at 2, and by 5, by kindergarten, like the need, right? Or they need a lower level of
Yeah.
support. That could happen. We
Mhm.
don't know. We can't predict that.
Mhm.
But just from what we've seen, there is a greater possibility that, that early intervention piece might be exactly what they needed.
Mhm.
So
Yeah.
yeah, let me get off my soapbox. I just, anytime we talk about early intervention, I'm like, just do it. Gachi osia, just don't try. Gachi
Yeah.
oa. And usually
Yeah.
it's free too, right? In most states,
Mhm.
early intervention is free to the parents and families, because the state thinks about, 同你老了天，你好 severity, 老差, just like with health insurance, right? It costs more.
Mhm.
So we're going to
Yeah.
treat it early, right?
Mhm.
Um, so just something to consider. Um, and I think it's interesting that we kind of feel the same way about our approach to early intervention. And then one time you told me that you're an RBT. I was so excited, right?
Oh, no, no, I'm not an RBT.
Girl.
But my my old SLPA, she was an
Oh,
RBT.
okay, okay.
Yeah, she was an RBT, and an SLPA. But
Yes.
a lot of us, like paraprofessionals, like OTs and SLPs and stuff,
Hmm.
like we will go ahead and instead of getting like a whole nother degree because we already have our degree to be like an SLP or an
Hmm.
OT. Some people will just get like that like RBT training and that RBT certification because we
Yes.
value like those ABA techniques so much and we want to learn about like behavior analysis and how
Hmm.
to apply those techniques because I mean like really like we cannot like you can't be an SLP without like applying like some like ABA techniques for sure. So a lot of people will go for that just to have like that information and that knowledge in their back pocket.
Yes. I've met a few SLPs who are BCBAs, so that's really exciting.
That is really cool. Wow.
Yeah, I mean it's a lot, I'm sure, but definitely a when you join a clinic, you're very profitable. To have like a dual, 2 in 1,
Yeah.
that understanding, because I see the speech path that we've had before, and like we use the same strategies, right? Because as
Mhm.
we know, that positive reinforcement component is super
Yeah.
helpful.
Mm.
For speech, it's like you're constantly thinking, same with, I was just having this conversation with a parent, like when it comes to speech or tolerating, it's like a form of control, like that's like the
Mhm.
two things they have, right? Cho khó như tụi mình nhỏ chỉ sa giàu nên chỉ sa sợ nên chỉ sa nạc hơn giờ nên chỉ sa um chỉ bà hao you don't all thought new, or you want to throw a brush and then brush their hair, right? You can still
Mhm.
control that a little bit. It's not fun, but you can. But with like bà xí không na thứ hai lù ở không đó you control chỉ tao đó khó
Mhm.
you chỉ tôi nâng tới sa wa như sa cho gì như sa hai lù, right? So I think that ABA is beautiful for that, because we're always thinking, what is motivating, right? What is so motivating, super motivating that gu hay ya gu mo hay tia okay Lu ka hay la lu na gu mo ka no ka, or gu gu ka shy YouTube inati, like what am I looking for, right? That's motivating to you, that will make you go, okay, ball, that's a ball, So I think that's where our professions kind of intersect, and I think it's really interesting.
Yeah.
What are some ABA strategies that you use daily?
Yeah, so kind of just like what you talked about, like finding what's like motivating to my
Mm-hmm.
patients and using that to make, therapy, like, more fun and,
Mm-hmm.
not so static and make it more, dynamic and make it, like, personal and meaningful to them rather than just, "Like, tôi chỉ có ai thì only know," like, yeah, like, rewards definitely, and, like, visual schedules, and,
I love visual
uh
schedules.
yeah, oh, yeah,
They're my
like,
best
any
friends.
any sort of, like, visual aid, like timers, to, kinda help keep us like organized in our therapy
Mm-hmm.
sessions and to kind of like break things down and make things seem so much more like achievable, because when I was in grad school and we were learning about how to do speech therapy and we were learning about just like the speech therapy, and I was in like the outpatient clinic at like my school, and they would like bring in these kids for me to like see and practice speech therapy on,
Mm-hmm.
and like, sometimes it did not go well, like, sometimes it was, like, a real struggle, and then only when, I started working where I do now, and I was introduced to, like, all of these, like, ABA techniques, like the visual schedules and, the visual timers and things like that
Mm-hmm.
did I really start to feel like my speech therapy sessions are really coming together and my kids are, like, learning and, like, this
Yeah.
therapy that I'm doing is, like, working, and it could not be without, like, the help of those ABA techniques, yeah. So,
Oh, that's
shout
so
out to yeah,
wonderful to
shout out
hear.
to, like, the ABAs and all that you guys do, like, we literally, like, could not, like, we could not be without you guys, so
Oh,
shout
well, we
out to
can't
you
be without you guys. I'm very much like, whenever they go beyond, like, what we are trained to do, I'm like, let's get in touch with your speech path. Let's coordinate some care here. Okay, I feel like, for us, we've been doing okay with the Hmonglish, but maybe some of our listeners are like Hai Lum Hmong, the J, Hai Lum Hmong everywhere, Hai Lum Hmong, the school, and that's great. But we've seen that some of Yami Yoya Hai Lum Hmong, Silla Nom Hmong, that you look like in the J, Hai Lum Megala, right? And that's okay. But what about 被人有 with autism? 有日子有知道晒嘅古沙嘅古點樣係路芒式 or 你係路咩解釋 or 你得住係路哩 so I have to pick one or the other because that's what the therapists are teaching them, right? So and this is a conversation that we've had many times, is that To'itu learner is considered a dual language learner, which really, Kutya they don't know Hmong. They might know like mama, guy, sapua, but like so the Kutya by enroll, I don't say that they know Hmong because they don't, right? I know Hmong, but even not that well. So there's this a little bit of confusion about how do we identify our kiddos as being a dual language learner, but then for our kids with autism, like, do you feel like dual language learners are at a disadvantage or an advantage in terms of overall speech development. The call, yeah, you hello. If you're typical speech developing learner, you could, right? You could do dual. You could do English or, well, I've had many Hispanic clients who maybe spoke English because it made sense because they go to school and learn English, but they understood Spanish too at home. And
Mhm.
so the parents were like, they understand it. I'm okay if they don't speak it. So like where do you fall on that? Like, do we choose the native tongue, or do we say, hey parents, we have to choose one or the other? How does that work?
Oh, I absolutely think that you should continue to encourage development in both. Yeah, because
Okay.
there is just like so much research out there that shows that there are all these like positive like benefits and boosts to like neurological activity whenever people can are bilingual, or whenever they can speak two languages. So I think that, you should definitely do both and don't feel like you have to, pick one or the other because,
That's great to know, Lou.
in yeah, and because in speech therapy, um, I whenever someone who with a speech delay comes in, and I'm working on like that total communication goal, like we were talking about
Mm-hmm.
earlier, like encouraging like all methods of communication. I mean, that's essentially like teaching like multiple languages. Like sometimes I'll pull out like the communication device, and like be teaching them how to communicate on the communication device, and that really is like a whole language on its own too, right?
Mm-hmm. Yes.
So yeah, I mean, all of like that extra like language stimulation, and all of those other ways to make like those like neural connections in the brain by speaking multiple languages. I mean, that's
Mm-hmm.
just that's just nothing but good. So I definitely would not recommend against, or I mean, I definitely wouldn't recommend saying, "Oh, we have to choose one language or the other."
Mm-hmm.
Definitely, I would encourage parents to, if you're speaking both languages to your children, go ahead and do both.
Oh, that makes that kind of that is great to know. One, and then two, it breaks my heart because we just had a case recently, with so Bay Hmong, Bay Hmong, and this story is kind of similar to that in that go recently oil halu da aging have you heard of the language is Zomi,
Oh.
Zomi, and it's the
Mhm.
Zoe people. They're from Myanmar. I think it's like Myanmar,
Oh.
India, Bangladesh. It's like they are they have been religiously persecuted from their country, so they've kind of settled here in this Midwest area. And went to a family that came, and that was the exact problem that they had was that tụi nhờ thích gì hai lưu dâu xí thì mình nhờ mua cần tới là nếu mua cờ lưu mê ca nếu bó hai lưu mê ca là xí nếu là rất chế nếu and so he has autism too, right? And on top of that, he has autism. So nếu tao tao English only, communicate on digital, and it's so frustrating for them because they're like, we just want to understand. And so brain soaks up everything, right? So he picked up English quickly, right? And his parents are not English speaking, and so they're struggling with that language barrier. I mean, talk about frustrating for both sides, right? The kid was
Yeah.
like, I can't tell you what I want because you only understand Zomi. And the parents are like, I can't tell you what I want because you only speak English. So it was a very unfortunate situation. And I kind of wish I could still reach out to them and be like, actually, Miss Lou said do both. It's okay. You don't
Oh,
have to choose one or the other.
oh, that sounds so sad, but, I mean, if
Yes.
I could speak to them, I would definitely recommend, that they still continue to, like, work with him and, teach him their, like, their native tongue, like, it's not the end.
Yeah.
He can still acquire it, I would believe.
Right. And I think too, cái này rất dễ hiểu được. Okay, you li ge be hai lu me ga se to ha thi li yung yi. That she how you she yi pung sa te that she go in sa ka go tim yo pop. Ở bên là lu mo e yin thon ni hai go thi li it's okay. You can ask me. You got the analyst. Ask me. Ask Liv. She's your, but it's y'all that she. If you have one, ask them. Don't ever think that. Go ask what she thought because maybe like that you bought the side. So you got ask. I bet you 99.9% like that. Yes, let's make a goal. Right? I would. I'd be like, yes, let's teach Nia Titsi or Nia and C. Right? And then we would do, DTI, some discrete trial trainings, and be like, okay, who is this? Show them a picture, and they would say, Nia, right? Who is this? I was like, see, right? So, like, I would do that. And I'm sure you would too, right, Miss Lou?
Yeah. Oh,
Yeah.
yeah, absolutely. Yeah, because what I mean, part of what we do is taking into consideration like what's important for the families, right, and what's functional for them. So yeah, absolutely.
Yes. You talked a little bit about AAC devices, right, as a form of
Mhm.
communication. And AAC, remind me what that stands for? In Hmong. Can you say in
Oh,
Hmong? How would you say it in Hmong?
oh man, I have a hard time remembering it just in
I
English.
know. Augmented alternative communication device or
Yep,
maybe
yep, augmentative and alternative
yes.
communication. So AAC, 要点有摸鲁蒙了别给要 oh my gosh, maybe you're gonna need to help me out here, Tia. 你呀，我约了抽到鲁了抽到要则给可以从的都 that's what AAC is. So this can include you know, things just like gestures, things that are no tech, things that don't use any sort of technology, like biate, lashi ASL or
Mhm.
sign language, and then there's
Pictures,
yeah, low tech, like yeah,
text.
yeah, pictures,
Mhm.
like a picture communication exchange system, like
Mhm.
your 一样的我了是一个多我莫太多and then you go all the way up to high tech AAC, which is things that may require like a battery, like a communication device.
Yeah,
Yeah,
the
so
little iPad,
mhm,
like a tablet.
yeah, li ilu iPad, 我摸多我多我一度宁有点了还知道了给了是对了对多一个了了我的给看到了有还得了了撒到的去了是了撒里呀 yeah, so that's what AAC is.
Yeah, so the question is what are the pros and cons of using an AAC device? But I wanted to tell you and kind of get your input too, because I'm always seeking like the advice of the actual professionals of speech, which would be you guys, the speech path. I had a parent who felt like it's interesting. His exact word was he has trepidations about using his child using AAC device because he didn't want the AAC device to replace her vocabulary, her communication. And I was like, no, you want to use the AAC device because you want her to have overexposure to all these buttons, all these words. Even
Yeah.
if she is pressing that one button over and over and over again and she's being denied access, she knows it has meaning. It's powerful,
Yeah.
right?
Oh,
Like she's using this
absolutely.
as her voice. And I always tell my RBTs that is their voice. Do not leave their voice behind in the bathroom. Go back and get it. Like, where is their voice? Why is it in their room? You're walking the hallway going to lunch, go back and get their voice, right? Like what would you do if one day you woke up and someone was holding your voice across the room, right?
Right.
Or
Oh,
put it in the
absolutely.
or put it in a
Yeah.
drawer or locked it behind a door. That's your voice. So I always approach it that way. Would you say that's a I mean, how do you approach AAC devices and how important it is?
Yeah, yeah, absolutely. Just like what you were saying, Tia. I mean, some my coworkers and I were talking the other day about how one of my coworkers witnessed a student who was with somebody like a teacher or something, and the teacher didn't want them to like wanted them to like stop talking with like their AAC
Oh
device,
my
so like they like
gosh.
took it away, and I
No.
was like I was like, "But what would you do with, like, somebody who was verbal?" Like, you
Yeah.
can't, like, take away their voice,
Right.
yeah, literally, you cannot take away somebody's voice, and then,
Mhm.
with an AAC device, exactly like what you said, Tia, like that is their voice. Like you cannot take it away. Yeah. But yeah, to I mean, everybody is always parents are always a little bit iffy whenever I start talking about like getting like a communication device for like their child. And like almost always the look that comes on like a family's face whenever I start talking about, oh, I'm training them with like a communication device, or I think I'm gonna get them like a communication device. The look on their faces are just like a look of defeat, because they're like, "Oh no," like the
Oh,
speech therapist thinks that like they're never going to
never
be
gonna
able to talk.
speak.
Yeah,
Mhm.
and this is the reason why like we're having to like resort to like a communication device, when
Oh,
it really should not be looked
no.
upon that way at all, because like what I was talking about earlier, about how some we take for granted the desire to communicate. We take that for granted, but some people, they really don't have a desire to communicate. So any
Okay.
sort of communication method that they want to use to communicate with us,
Mhm.
like even if it's not something that you or I use every day, like our verbal communication, if they want to use AAC to communicate with us, like we should be excited about that, and we should
Yeah.
honor that. Yeah, so I know that there's just this huge stigma and this bad kind of rep that AAC has. But if anybody is listening to this and you have more questions about AAC, feel free
Mhm.
to reach out to me, and we can talk about AAC. Yeah, but AAC is well, it should be looked upon as somebody finding their voice to communicate. Yeah.
100%. And it's not just about communicating what I want. It's sometimes
Mhm.
communicating how I feel, because when you
Yeah.
visit, don't you want to know how your child feels, how something made
Mhm.
them feel, how they're feeling? And I used this example the other day. That same kiddo, she's been working on it, and with the staff, she must have had a good pairing with the staff. And I was on her supervision, and I heard her, Lou, type out, and so you type Donna, you shut your door, you yay the button, then you press the button, and then you might hike a whole sentence, right? Sometimes, right? Sentences,
Mhm.
or just one at a time. But for this one, it was a whole sentence, and she typed out "I like you" for her
Oh,
tag. And I was like,
how
she said what?
sweet.
She likes you? She's like, she feels good in that moment in therapy, and was having fun and enjoying herself. And she wanted to communicate to her staff, "I like you." And I thought, how amazing, right? Like, what if
Yeah.
she had to go so many years without telling people, "I like you," or do you like me? Or, are you having fun? Or, I'm having fun. Anything like that, right? So it's not just about, like minging, asking for what you
Yeah.
want. It's for everything, and so,
Absolutely, yeah. I
and
remember,
mhm,
one of my little girls in my clinic, she's an AAC user, and she's functionally nonverbal, but I was able. This was around Halloween time. I was able to program into her device, Happy Halloween and trick or
uh-huh,
treat. So she
yeah.
got to go trick or treating, and she got to use her
Oh
AAC device to
my
say trick
gosh.
or treat, and it was
Yes.
just, it was just the most precious thing ever. So this is the kind of stuff that that can happen whenever we accept all forms of communication, and we don't think of like verbalizations as like the
Yes.
one and only goal. We get to include nonverbal children in things like trick or treating, and we give them a voice to be able to do that just like other
Mhm.
children. So don't look at AAC like it's such a bad thing. Yeah.
Right, or some parents think, "Oh, the kid will get lazy and only use it to talk," right?
Mhm, mhm.
And I'm
Yeah.
thinking, "No, they will be so overexposed to those words and that picture and making that connection." And, kasi kuna, we cannot predict for any of our parents. We have seen that AAC device for operation, and then and they built this
Yeah.
big vocabulary all those years thinking that we don't know that. So
Uh-huh.
why wouldn't we? Why would we withhold that from them building them
Mhm.
for their vocabulary, right?
Yeah, yeah, absolutely. And going back to I was when you told me that you were gonna bring me on so that we could talk about this kind of stuff, I thought back to this research that I had read that there is no research out there that shows that AAC negatively impacts like speech and language development. If anything, it only has like positive
Yes.
benefits on speech and language acquisition and development. So yeah, you're absolutely right that AAC is not going to like make kids lazy and make them not want to talk, and they're gonna use that as like a crutch. It only has been shown through research to have positive benefits on speech and language.
I love that you bring me back to the science. You're like, Tia, the research says. Stop going based on your feelings. Thank you, Lou. I love you for that. Okay, so I knew we were gonna be like both of us. Like, I think whenever we chat, I think that's why I was like, she's gonna be one of my very few first because we always want to have all these conversations. So we are having them, but we are at the hour mark, and I just have one more question for you. And we just
Yeah.
kind of touched on that too about like AAC devices. We never know, right? What's gonna happen? You might have a client, I might have a client. They don't need us anymore, and that is the goal, right? Like we don't like we hope that our therapy is so amazing for your child that that's great, but that's okay too. But would you say
Mhm.
that in general, like is speech therapy a lifelong treatment?
No, as much as I wish that it
Yeah.
could be, because I develop these relationships and I'm just like, I just want to like take these kids home, and I just want to, like just to keep all of them in my house and they could all be my kids too. No, speech therapy is not a lifelong treatment. Back to the conversation that Tia and I were having earlier, the saying that like therapy and teaching are different, in that Tia, what was it when we started recording, or was it before we started recording, that we were talking about like teaching and therapy and how therapy is different? But either way, yeah, teaching and therapy is different, because teaching, you can always teach, you can always learn, but the goal of therapy is to teach skills and to have them apply those skills elsewhere so that they will not need you anymore. So no, unfortunately, unfortunately and unfortunately, speech therapy
Hmm.
is not a lifelong treatment. The goal is to get all of our patients to be as independent and functional as possible without us. Yeah.
Yep, absolutely. I feel the same. There are some kids go with it. Oh my gosh, we're sitting in a jail, but that's illegal. Don't do that. I have to work to provide for my children. I can't do stuff like that. So, because you're working with them so many hours per day, weeks, months, but then you know that you'll graduate out of your program, or they make so much progress, right? And then it's amazing when you see them later, and you're like, oh my gosh, I'm so old. How are you a teenager now? So yes, well, thank you, Lou, so much for just sharing your expertise and your just thoughts and everything that you have to teach us all about speech therapy, and for your contribution as well.
Well, thank you so much for bringing me on, and like I said, valuing what I have to say. And yeah, thank you to all of those of your listeners who tune in and are listening to us. Yeah, thank you guys so much, and thank you again, Tia.
Thanks.